Hello everyone, and thank you for tuning in. I'd like to emphasize a few things about smoking. I understand that it is very addicting and even harder to quit. As an anesthesiologist, it's important to emphasize that it's not just about its association with cancer, but its effects all over your body. Of course, we understand that smoking causes airway inflammation and airway narrowing. That means that it is hard for oxygen to smoothly flow from the environment down to your main breathing pipe and your lungs for the blood to take oxygen to your tissues. Furthermore, smoking can cause sputum production, and it affects the cells of the airway so that sputum builds up. It becomes difficult for your lungs to even clear that sputum. The airway also becomes reactive. That means that smokers are more likely to go into a spasm and coughing spells that can further compromise how well oxygen can get to the lungs, the blood, and into the tissues. This altogether means that it does increase your risk of pneumonia and respiratory failure. And of course, the more you smoke, the more severe things can be. Outside of the lungs, smoking affects the heart. And because oxygen struggles to get to the tissues and the cells, it can cause a heart attack. And it can affect the pacemaker cells of the heart, so you can develop dysrhythmias or irregular rhythms. It also narrows the arteries around the heart, predisposes one to plaque buildup in the arteries of the heart, and it can increase your risk of stroke and bleeding in other areas. Because there are narrowings along the vasculature of your body due to smoking, you can also experience muscle pain from the lack of oxygen getting to those muscle groups. On a more granular level, smoking affects your immune system, so it takes longer for wounds to heal. And if you have a wound, it makes it easier for bacteria to get in. So smoking is badness, and the more you smoke, the more badness you experience. If you know that you're having surgery, it is best to quit smoking 2 months before your surgery, or it's best to stop smoking 2 months before your surgery to minimize those airway complications and to improve healing. Again, I understand that it is very difficult to quit smoking, but let's do it together. Talk to a doctor. Let's put a cigarette down, one cigarette down today, and let's be well together.